Welcome to Treating TMJ, a journey to a pain-free life.
TMJ and Sleep Center podcast with Dr. Insolera. I'm Randy Hawk. Joining us now is Julia from Rebalance.
Hello. Thank you for having me.
Thanks for coming in. Now, you're a physical therapist. We've had in nearly every episode, physical therapy as a component for the treatment has come up. And on this episode, we're really going to focus on the type of physical therapy you do, and it's a much deeper therapy. Is that the fair way to say it, Dr. Insolera?
Yeah, I'm going to let Julia.
Technically, I'm not a physical therapist.
Okay.
I work with the physical body. I'm licensed as a massage therapist.
Oh,
but
okay.
I do what's called myofascial release therapy. And the fascia is a connective tissue that covers your whole body, so it operates a little bit differently than the muscles do.
Okay. So explain to me even what the word fascia means.
Well, Julia can do this too, but basically when I see a person that's long-term and might have trauma over a long period of time, that means those fascial components are sticking. They're not moving smoothly. Fascia allows the muscles to move smoothly. When you have these sticky components, now we got some problems. And people who are experienced, like Julia, are able to find those sticky parts.
Right. So sometimes, like something like if you put your arm through a range of motion, you might feel a glitch, or where your arm all of a sudden twitches to get past a certain point. That might be a fascial restriction.
Oh, okay. So,
or in your neck.
Yeah. So I was
head.
just going to say, so that's absolutely positive. You know, you can see where, okay, so part of the compensation starts to create that. Is that fair to say?
Yes, absolutely.
And then you can identify and through your techniques and massage, treat that.
Yes. And I know where you were talking about compensation patterns earlier, sometimes it's hard to see how those would become long-term. But let's say you're learning how to walk and we put you in a small high heel on your left foot when you learn how to walk. Now your body compensates. One hip is a little higher, then your other shoulder is a little bit higher, because your body's always trying to keep your eyes on the horizon line, so you can see straight.
Okay. So that's where the so that's kind of the centering point,
right,
for how the rest of your body reacts,
right,
and it's almost the highest point. So that
it is, and it goes straight through your neck, your jaw, and your neck, and down through the rest of the body.
Right.
That's an incredible way to visualize it.
Yes.
When you think about that, because even it's funny when you said put the heel on, first thing that I thought of was your shoulder goes up. You know,
exactly.
So you're like the whole left. If you put the heel on there under the left foot, the whole left side of your body will go up, and you'll lean to the right.
Yes.
And
it'll actually
I never
zigzag.
thought about that component of. So then what you're really trying to do is center your head. So if your left shoulder's high, your head goes to the left to center your eyes.
Yes.
Am I following it?
Yeah.
Yeah. And then those joints can't function properly. So they get ground down in unusual positions because they're no longer tracking the way that they should track.
That's part of the postural influence on the bite. Yeah.
And then you have you've developed techniques to start to adjust this as it relates to TMJ?
Yes. Myofascial release is technically a very light technique. It's light pressure for a long time.
Okay.
Whereas instead of coming in and forcing something into position, your body tissues remember. So if you force it, it's going to cause more pain. Sometimes you have to use a little finesse and get an old pattern to let go.
So it's less of a shock to the system and more of a longer term solution.
Yes.
Because even some of the shock to the system, so when I hear a couple of the guests have said, so I popped my jaw back in place, I just go, ah.
Yeah, that's not good.
No.
Yeah.
No.
And so
We don't like
the massage therapy is more about, is retrain a good word?
Well,
or
I don't know if it's retrain because they've never been to the right place.
Okay.
So it's training.
Yeah, we're trying to get it to the right place.
Yeah.
So initially even getting them there in the first place.
Yes.
But what she does is going to make it easier to allow this person to achieve a range of motion without all the glitches or the sticky parts that you're talking about.
Yes.
Yeah.
Because the compensation patterns start to affect. You just use the term range of motion. So almost any act that you would carry out,
absolutely,
the patterns continue because you're doing them from the wrong spot.
Yes.
And it's everywhere, and that's where in the jaw as well. So the jaw's got the same thing going on. So again, what we provide is we're setting the table for function 5,000 times a day, and now the therapists have to do their thing, and they do their thing, and then the patient comes back to me, and I see what kind of changes are in the bite because the bite's changing because of what they're doing. So it's a back and forth balance, and that's it's dynamic. It's really it's actually fun because you see these patients start to improve. But you might, if I'm wrong, but I don't. What happens is as you improve, sometimes you improve, and it could be a little sore or a little painful, basically because you've never been there before. So this is new ground, and these muscles have to change.
So the person has to almost make an adjustment to the correction.
Oh yeah, well, sorts. Yeah, certainly.
Yeah, sorts. Yes.
Okay.
Like if you constantly lift something a certain way and then you try to lift it in a different way, your muscles are working in a little bit different position. You may not be as strong, or it may be more painful.
That's true.
Okay.
In those muscle fibers, we forget how small you think about a muscle and how big it is, but we forget that how finely tuned the body really is. So one little change can make a big difference in your capacity to function.
And I come back to this often because it only hit me the first time I had a consultation with Dr. Insolera about how much is going on. Let's go back to where you said, from between your eyes and the base of your neck.
It's a real big point.
Right.
It's a real big point.
And you use that part of your body for a lot of things.
That's why those neck muscles can be extremely sore. I'm talking about the scalenes now.
Oh, yeah.
Because what I notice, and it's in 4 months, is when we retake that X-ray, the person could be, the optic plane level could be more this way, and in 4 months, it's more this way.
So instead of going down, it's a little more up
more
or even
and
or
change
with the horizon.
Because of the shifting of the bite and the posture working together to do that.
Yeah, with the head forward posture so much. A lot of people come in, and though they're having TMJ issues and they're working with Dr. Insolera, they come to me, and they come in, and their first complaint is back pain.
Absolutely.
Because if your head is forward, what part of your body is going to keep you from falling over?
Yeah,
your low back.
Every time you do that, I'm like, okay, let me think. Yeah, I'm going to do my
I wish
research
everyone
before I
could
answer this question.
I wish everyone could see you right now.
My lower back, because I just moved that way.
Right, but if some part of your body is out of whack, if you tip your head to the left, pay attention to what does the rest of your body do. It's going to compensate in some way, temporarily. But when you've had an injury, that may become more permanent, and then you have more issues.
Right, and with me, it was just between the shoulders and up the neck. But I actually, we talked about this, I had a high school wrestling accident where I cracked my second and third vertebrae.
Wow.
So that's kind of where some of my trauma started.
And then you also get scar tissue around because there was a trauma.
And that's
so
where she would be very good, because she can figure that out and see it and feel it and relieve that for you, which would make your PT that much better to do, easier to do. Yeah,
because that's the scariest thing for my PT was honestly like foam rollers hurt my back. I was like, I'm fine with this and the massage and the other stuff. I'm like, oh man, I've tried those foam rollers, but luckily I learned how to do it right. I was doing it wrong, but that was scary for me. I'm like, the foam rollers hurt. I'm like, it's hard to say a piece of foam hurts, but it hurts.
Yeah, sometimes you can make things a little more uncomfortable to get to the comfortable.
Well, there is going to be an uncomfortable component. I mean, you see that all the time. We see it. But as the function happens and you're doing it many times, the consistency of what you're doing, or if you tell a patient do something, or I tell a patient do something, over time it starts to lessen. The muscles get it, and then we get that opening. Remember when Krista was saying about she couldn't open and now she can open? That's because of the consistency of wearing the orthotic, doing the posture, and working it.
Yes.
And the thing with Krista, I was really surprised because I didn't know that hers was that severe. I knew she was super happy with how things were going, and then just having her in here as a guest, I was like, whoa! I didn't know that it was that much for you, considering her job. I mean, she's on the radio 4 hours a day, and she talks, and I'm like, I had no idea she was experiencing that pain. Yeah. And now to see where on her journey, she's gone pain-free, because you and I've talked about that too, where the average person moves their jaw 5,000 times a day. Krista and I are probably 10.
Yeah, probably right. You're probably right.
Yes. Well, I remember right after I started working with Dr. Insolera, we were on vacation, and my 16-year-old slid her plate over to me and when we were out to dinner one night and said, "Can you cut my food for me?"
Oh, yeah.
And I looked at her and I thought, "You're 16." She says, "I can't open my mouth big enough to bite that burger." So I had to cut up her food for her. And I looked at her and I said, "I know where we're going as soon as we get back from vacation." And we went and saw Dr. Insolera, and she could only open her mouth to 30 millimeters. And you think 30 millimeters is not big enough to bite a sandwich. Mm-mm. Well, now she opens at 55, and I can't get her to shut up. So
her demeanor has changed
be careful what
so
you
much.
ask for.
Her demeanor has changed because when I'll never forget this. Yeah. When I first came into the room, I thought, who is in the chair? She had this, I think it was a black hoodie. And I couldn't see her face. I couldn't see anything. I just saw this black hoodie. I said, was I saying her name wrong in the beginning? I don't remember if I was. Oh, it doesn't matter. Well, anyway, because I said, "I can't see your face. You're really going to have to move that hoodie." And I already understood she didn't want me to see her face because she didn't like what she was feeling. And so it was a journey for her. And
pain changes every part of your being, even if you don't realize it.
And she was just in, and she's got on makeup and eyelashes and all kinds of.
Yep. When she got her first mouthpiece, we walked out into the parking lot, and she started crying. And I looked at her and I thought, "Oh my gosh, my child's in so much pain." And she says, "No." She says, "I smile and I can feel the muscles in my face move. I've never felt that before."
She was very overclosed. So and
it was amazing.
And I love the stories like that. Give me chills. I'm just like to know that people are getting the problem solved is just so. What's the coolest thing about it for me? It's like the problem is solved. They're not masking it and masking it and masking it. Oh, you got pain there? This will solve that pain. Oh, it hurts when you do that. My dad.
Right. You have to look at the whole body, the whole being.
Yeah.
I remember when I was a kid. I grew up. You have to understand my situation. I grew up with an Irish New York dad who owned his own auto body shop. I was with him all the time. So. He had, right. So I'd be like, "Dad, it hurts when I do that." He goes, "Geez, and I wouldn't do that." I'm like, "Dad, it still hurts when I do that." "Told you to stop doing that." I'm like, I don't think that's a solution, Dad.
Right.
And so it's kind of the paraphrase of masking it instead of solving it is one of the big differences in going to the TMJ and Sleep Center and following the protocols to get the treatment and the physical therapy to become pain-free because the cause of the pain is gone. It's not masked or hidden.
Right. And when you have an injury, be proactive and take care of it. Don't fall into that.
Right.
I can handle it. I can work through this mentality. Take care of it up front, and maybe less of us would have this pain when we were adults.
And it can get to scary spots.
Yes.
I mean, I couldn't imagine being in a position where my jaw was locked open or closed. That would scare me.
Well, I could use mine to be locked closed for a few weeks. But we're not going to tell Dr. Insolera that.
Yeah, we won't.
Most of the people that work for me around here are like, "Can we lock his stuff?" When I leave, they're probably like, "Hey, how do we lock his up?"
Just for a little while.
If we turn his orthotic upside down, will we lock his jaw?
Yeah. But one of the things on the pain questionnaire is, have you had any trauma? And sometimes they'll say, "Well, yeah, but this was like 10, 15 years ago." But that's worse.
Absolutely.
Because the adhesions set in, those myofascial adhesions get worse if you don't do what Julia just said, treat it when it happens so it doesn't allow those things to settle in.
I think you hit on something that I don't know that we'd hit on before on that is, I don't know that people are like, well, it's only started to hurt in the last couple of years. They don't go back 20 years like when you took me through the process, we did get back pretty quickly to me injuring my neck when I was a junior in high school. And unfortunately, that was a long time ago, and I never think of it anymore.
Right. Well, and you don't think it has any value, but it has. The older the injury, the more value it does have because it's settled in and it's entrenched, and that's more work for you.
Absolutely. And people think a big injury, they think, trauma. People think car accident, hurt my neck in a wrestling match. They forget that they learned how to walk and fell 500 times on their bottom. or that they fell off of their bike
That's
when
a real- yeah.
or they fell off their
Real good
bike when
point.
they were 4, or the fact that they were born.
Well, you guess what? The pelvis of the lady definitely has some influence on the shape of the skull and the jaw coming out.
Yes.
So, yeah.
Yes.
Well, the good news is he used an illegal move, so I did win the match.
There you go. There you
So
go.
I did go out a winner. It was the last time I ever
there
wrestled.
you go.
Well, Julia, thank you very much. And how do people get a hold of you at Rebalance?
They can check out my website, www.rebalancemfr.org.
Perfect. Thank you so much for taking the time for joining us on the podcast and sharing the great stories of your daughter. That's an incredible story. And I'm so glad that, I don't know, would that have happened if you started working with Dr. Insolera? Maybe,
I don't know. I would have had to find him.
Yeah,
it
right?
was very serendipitous that he found me first. I like how that works.
She's really come a long way. She's fun to be with. She's fun.
Cool.
Yeah.
He doesn't live with her.
True.
She can work in your office with all that.
Yeah.
The
That's
girls in
true,
the
too.
office, they keep Dr. Insolera right on.
Absolutely.
I know.
Right on
Somebody's
task.
got to do it.
I know.
Thanks again.
Thank you so much for having me.
Thank you, Julia.
You'll have a great weekend.
You too. Thank you.